You are proposing requiring that hospitals post their pricing online and that doctors and hospitals transfer patient records to other physicians. So if someone is discharged, their physician would get a copy. It sounds like a great idea and something certainly patients want, but given how difficult it has been for the industry to really be able to share data easily, how hard is it going to be to get to this step, and what kind of timeline are you thinking about this to require these things?
Well, a couple things. One, we know that interoperability is already working. If you're within a healthcare system, we know that records are already being shared within the healthcare system. So, we're going to pursue making sure that patients have their data no matter where they go. On the issue of price transparency, we know that any other place in the economy, you can know what things are going to cost, but somehow in healthcare it's a big mystery. You don't understand, we're not given that information on the front end. It's very difficult to understand. So we're starting with just taking the first step, which is asking hospitals to post their pricing online. And that's just the beginning. We have a long way to go. We also put a request for information because we want to hear from the healthcare sector. We want to hear from consumers about what kinds of information and how we may advance that. All of this, whether it's interoperability or price transparency, it's all about making sure that we are moving to a system, a value-based system that promotes outcomes over just merely volume of services. One of the things that we haven't done in the discussion about value is that we haven't empowered consumers. They're not a part of the healthcare equation, right? So that we've created incentives for providers, we've created incentives for healthcare system, but where's the patient? So what we're trying to do is empower the patient with their healthcare records, with pricing information, with quality information. And I think when we unleash the patient, I think we're going to move much faster towards a value-based system.
The other thing that the administration is pushing for is to give states more flexibility with Medicaid, and you outlined where we stand with that you've approved 3 in terms of workplace requirements. There are 11 pending. What's the timeline to get those approved? A lot of these have been in since last year.
So we are moving as quickly as possible. I mean, we talk about Medicaid as sort of a new day in the Medicaid program. As you know, Obamacare put millions of people, millions of able-bodied individuals into a program that was built for our most needy, our most vulnerable citizens. And so we think that the program needs to change. It needs to be more adaptable and more flexible to address the needs of the newly covered population. We are responding to state requests. So we put out some guidance around community engagement. And that policy is all about helping people achieve a path to self-sufficiency, helping people rise out of poverty, giving them the skills that they need to fill the millions of jobs that are available today. So we are continuing to work with states. We look at every proposal individually. We've given some guidelines to states. We want to make sure that these are done in an appropriate way, that there is a sustainable path out of poverty. So we are working as quickly as possible, and I think you're going to hear more from us on this issue.
So Massachusetts is asking for the flexibility and ability to be able to negotiate drug prices and create a formulary in their Medicaid program. What are your thoughts on that? And do you worry that there might be a legal challenge to that?
So a couple things. I mean, one, I can't comment on any specific state negotiations, but generally we look at every waiver with the concept or the idea that we want to get states where they want to go. So we're going to work to help them achieve the objectives that they're trying to achieve. When we look at waivers, we look at them across a couple of different areas. One, we look at budget neutrality. We need to make sure that their proposals aren't going to cost the federal government any more than they would have under their regular plan. We're looking at them in terms of their ability to meet the objectives of the Medicaid program, and we're making sure that they're in with the, they have to be consistent with the law. So every proposal we're looking at under those 3 areas.
On the one hand, the government cannot negotiate prices when it comes to Medicare for drugs. And on the other hand, is required to allow those drugs to be dispensed under that program. It seems really illogical. Is that something that you think needs to be addressed?
Well, I think one of the things that when we're looking at the Medicare program to think about is that we have pharmacy benefit managers, and they have essentially been our negotiators. If we look at the Medicare program, premiums have actually been relatively constant or have actually gone down. So Medicare is a great example. I mean, it's been a fantastic program. It's kept premiums affordable. But I think there's a lot of work that we need to do in terms of how we can use the Medicare program to help advance incentives for pharmaceutical companies to lower prices, to lower list prices.
And finally, we've got open enrollment coming up for 2019 in the fall. This is the time of year that a lot of plans are starting to submit their rate requests. What are some of the things that people can expect, particularly in terms of timing for these short-term plans? Will those short-term plans be coming online at the same time as open enrollment?
So we had our proposal around short-term limited duration plans. We received a record number of comments, and so the agency's in the process of going through those comments. We want to move as quickly as possible, but we have to go through that process of considering what we've received. But we want to make sure that Americans have more choices. I mean, the bottom line is that insurance premiums have skyrocketed, and there's a number of people that just can't afford to pay Obamacare's high rates, and we need to create alternatives and more choices. So we're going to be doing everything that we can to make sure that there are new options and more choices for people.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.